Happy 2023. Let's hope that it is better than 2022. But certainly from a COVID perspective, it's not starting out looking so great. So let's take a look at what's going on and talk about what we can expect here in the next month or two. So I remember saying earlier, last year, that we probably were going to see a soup or mix of variants dominating over the course of the winter, and that we probably wouldn't see a single variant take over as we have previously in other waves. And as with many instances during the pandemic, I was wrong. So I think, unfortunately, we are seeing a new variant that is clearly taking over, at least in the US, and it is daunting, to say the least. So here's where we are in terms of official data reported into the CDC. Doesn't look too bad, right? Still well below 100,000 cases a day officially reported into the CDC. But as we know, this information is really bunk. The reliability of the reporting we're getting is such that our ascertainment rate is really off the charts. And so what we're seeing as official case counts, we really just shouldn't pay attention anymore. And what is going to tell us what's going on is hospitalizations and deaths. And the reason for that is, as we've discussed several times in the last several months, we're just not testing. And the testing we are doing is done at home with home antigen tests, which don't get reported. But the reality is people just don't want to know anymore. They don't want to know if they have COVID. And so our official PCR test counts that we base all of our case information on, we're getting fewer data points than we've received since May of 2020. And if you think back to May of 2020, we were scrambling to try and get testing going. And so we're obviously just not, we're looking through a keyhole at what's going on across the country in terms of cases. And thus our CDC risk map doesn't look so bad, right? So everybody's probably thinking that COVID's still over and it's not a problem. And again, that's also just garbage. Because what we're seeing now in hospitalizations is one of the more rapid rises in hospitalization rates that we've seen in the pandemic overall. And you can see we're hitting a slope similar to what we saw with Delta and Omicron, and maybe the OG strain that we saw in the fall and winter of 2020. And it's dramatically increasing in seniors over the age of 70. You can also see that the overall rate is kicking up, and it's kicking up in all adults, but it's really most prominent in the most vulnerable, where we are going to see unfortunately, the largest number of deaths. And so our death count is going to proportionally kick up quite a bit here over the next several weeks. And the reason for that seems to be this new variant that's now taking over, and that new variant is XBB.1.5. It is relatively new on the scene. Now, XBB has been around for a few months. I think I talked about it maybe in late October or early November, that it had been spreading across Asia and places like Singapore. And that was one of the variants of concern at the time that we were keeping our eyes on. But this is now a progeny of XBB, XBB.1.5, and it's much, much more transmissible and concerning, and we'll see why. But now our CDC nowcast, where we think we are based on previous data, and again, this is as of last week, is close to, over 40% of isolates in the US now are probably XBB.1.5, and that's nationwide. It's variable across different geographic regions, as we'll see. So what is XBB.1.5? So XBB, as I said, it's been around for a while, several months. Really first arose during the summer and was the result of a recombination event between two viruses of the BA2 lineage. This is, interestingly, the first variant that we've seen that is the result of a recombinant event, right? So two viruses kind of getting together and swapping genetic information, which generally leads to more dramatic evolutionary jumps than more incremental single mutation accumulation, which is how most variants have arisen, and all other variants of importance have arisen in COVID. So when this first came out, again, this was many months ago, it was deemed the Kraken because of this kind of large evolutionary jump from a recombinant event, and did have a significant impact in places like Singapore, where it spread rapidly, but then was somewhat overtaken by all of the other variants in the soup, and it kind of receded. But since then, it has continued to evolve now in just the normal accumulating single mutations type style of evolution. And that led to XBB1. And now what we're seeing is this new XBB.1.5, which I am terming the super Kraken, because it is much more transmissible even than the original XBB. And you can see that XBB1 was a big jump over XBB in terms of the relative reproduction number. XBB.1.5 is also a significant jump beyond XBB1. And so now this has been in the news over the last week or so as sparking a dramatic upturn in cases in the US and in a number of places. And now lots of people on the global scene are worried about this new super Kraken. And the reason is the data look very concerning. So this is from a virologist who looked at a series of studies examining neutralizing antibody titers and binding affinity of this new virus, XBB.1.5, for the receptor, the ACE receptor, which is where it attaches to the cell, comparing how strongly it binds to other viruses of the Omicron lineage. And you can see where that large arrow is pointing that XBB.1.5 has a much higher binding affinity for ACE than most of the other viruses in the Omicron lineage, including BA2, BQ1, and even the original XBB Kraken. So this XBB.1.5 binds much more tightly, which means it's able to infect more readily these cells. The other thing is it appears to be even more immune evasive than many of the other viruses, well, all of the other viruses we've seen recently. You can see it's boxed there on that graph of neutralizing antibody titers, and the lower that titer is, right, so we're down below 10 to the second for XBB1, the less well antibodies neutralize that virus. So this is from patients who were vaccinated with the mRNA vaccine and then also infected with the BA5 virus, right? So a relatively recent variant. And you can see that XBB lineage, it has a much lower neutralizing antibody titer than any of the other variants that we've seen recently, even more so than BA1, the original Omicron, right? More than a log difference there. And even BQ1.1, which is the virus that has been up until recently causing most of the cases across the US and seemed to be kind of the king of immune evasion before XBB.1.5 came along. So two problems: it binds more readily, it infects cells easier, and the second problem is it evades immunity from prior infection and vaccination. And as a result, its ability to spread in populations is dramatically higher than anything we've seen recently. You can see that all of the recent Omicron variants there, going back into the fall, have relative reproduction numbers that are between 1 and 1.3, really, and sometimes drifting down below for older variants that are now kind of out of fashion, so to speak, and not able to compete anymore. But BQ1, which was a big jump up and really scary that a lot of us were worried about, you can see really only got up to about 1.3. Now XBB.1.5 is dramatically higher than anything else we've seen so far, and that is really concerning. And so again, this just reiterates, this is another paper that was from Kei Sato, a virologist in University of Tokyo, that again shows XBB escape from neutralizing antibody titers from previously infected sera. This is in hamsters, but again, similar data showing much lower neutralizing antibodies for the XBB variants. And this is the OG, this isn't even 1.5, right? So 1.5 is even more. And so you can see against BA2, BA5, and BQ.1.1, dramatic immune escape. And then if you look at kind of the antigenic differences between XBB and other previous variants, you can see that it is a dramatic departure from BA2, its parent lineage, and XBB.1.5 is even more. And again, even more so than BQ.1 was from its parent lineage of BA.5. So again, another way of representing how much more transmissible this virus is relatively now compared to any of the other variants out there. There it is, XBB.1.5, just off the charts in terms of comparison to any of the other variants that we've seen recently. So it does appear that this is going to rapidly take over across the US, probably as the single dominant variant for the next couple of months. And we're already seeing that happen in New England. So in HHS Region 1, here is the sequencing data over the last couple of months. And you can see XBB.1.5 really didn't appear on the scene until November. It started to gain a hold right at the beginning of December, and then over that month of December, it went essentially from being relatively inconsequential to now it represents 75% of the isolates that are being sequenced in New England. And so what are we seeing in New England? We are seeing huge jumps in hospitalization rates. So this is in Massachusetts, and you can see for 70 and above in terms of new daily hospital admissions for COVID. This is now the third highest rate we have seen during the pandemic. Only Omicron and the original virus surge of late 2020, early 2021 are higher. And you can see as the trajectory goes, this is similar to the trajectory we saw with Omicron, which was the highest acceleration we've seen yet and until now. And it looks as if the ceiling of this may be close to what we saw in Omicron. And for that age group, which is, again, the highest risk, that is really concerning because that's where we see most of the deaths and all of the burden on hospitals that have occurred during the pandemic. So again, just going back historically, you can see that first wave was the original Wuhan strain with the D614G mutation that rapidly took over. Then you can see the Delta wave, the Omicron wave, BA2, BA5, that little blip that was BQ1 and BQ.1.1, and then this dramatic acceleration that's occurred since XBB.1.5 has come on the scene. Similar in Connecticut, where we've seen rapid acceleration there. Moving down the coast on the East Coast, you can see we're starting to see that rapid upward deflection in places in the Mid-Atlantic, like in Pennsylvania. Also in Virginia, dramatic increase. West Virginia, you can see we're almost at Omicron levels for hospitalizations in West Virginia. North Carolina, XBB.1.5 down that far south is not completely taken over. So this is kind of a combination of still BQ.1.1 and XBB.1.5. So we can expect continued more rapid acceleration once XBB.1.5 takes over there. And even in states off the East Coast now, but large states that drive lots of the national numbers and eat up a lot of national resources, places like Texas, we're seeing, again, a dramatic rise in hospitalizations in over 70 and in all age groups, but really primarily in seniors. And again, California, we're starting to see that upswing as well. So unfortunately, I think over the next month to 2 months, January and February are going to be really ugly in the US. And right now, based on trajectories, we could see hospitalization rates and deaths that even approach what we saw in Omicron. I hope not, but the reality is we are in many ways less protected now than we were back then in terms of lots of folks in the US have not received a dose of vaccine in well over a year, as we've talked about. And essentially, if you haven't been vaccinated in over a year and you haven't received the bivalent vaccine, you are almost unprotected against this new variant. And again, even with prior infection, it's probable that folks were infected close to a year ago, maybe infected with BA.1 or BA.2 or BA.5 6 months ago. And again, that's probably not giving you a tremendous amount of protection. So we are really in trouble here, unfortunately, going forward for the next 2 months. Last thing to mention is we really need to keep our eyes on China. I think the global impact from what's happening in China is not even beginning to be manifest, but it will over the next 6 months. So China has essentially thrown up its hands, and certainly surprising to me, and I think many others, but I think some experts did predict this, that instead of sort of gradually ratcheting down from their zero COVID and trying to maintain a kind of a soft landing in relaxing non-pharmaceutical interventions, China essentially went from zero COVID to zero negative, as many people are calling it. They just completely abandoned almost all interventions and testing, and they're not reporting is the other thing that I think people need to recognize. Right, there is incredible disincentives now built in for regional, provincial, and local folks to actually admit that there's COVID in their jurisdictions. Heard from multiple contacts that in hospitals, if you want to list COVID as a cause of death, there is a mountain of paperwork that you have to go through to get that approved. And so the result is nobody's listing COVID as a cause of death. And so, of course, official Chinese reports are there's hardly any deaths happening from COVID, while at the same time, as you can see, crematoriums are overwhelmed in many of the large cities in China right now. And the WHO has expressed very high levels of concern about the lack of transparency coming out of China. So what's the result of this? The result is China is going to experience massive toll of death, massive toll of long COVID that is probably going to significantly affect their economic productivity and supply chains and things that have, I think many thought were relegated to the history and past of the pandemic, but may not be so. So this is not a good beginning to 2023, unfortunately, globally, as well as in the US. So that's all I got. Thanks, Shelley.